The atmosphere in the examination room was intense. Brenda Jones had brought Granny Jones to be evaluated by Dr. Bruce, and things were not going very well. Granny Jones had led a relatively healthy life and lived to be 92. However, she had started developing episodes of confusion, and her memory was failing. She was also having difficulty making it to the bathroom with numerous accidents. For Brenda, it had gotten to be too much, and she felt she was no longer able to take care of Granny Jones, and had come in with Granny to discuss nursing home placement with Dr. Bruce. Since Granny had become somewhat unsteady on her feet, Brenda had brought her into the clinic in a wheelchair, and she was seated in one of the straight-back chairs with the hard plastic back in the exam room. After they had been sitting in the exam room for what seemed like eternity, the door opened and in walked the doctor, who appeared to be in his early 50s with dark brown hair and a mustache, wearing a long white lab coat that had his name, Dr. Bruce, embroidered over one pocket, and the Sisters of Compassion, with a Maltese cross embroidered over the other. He presented his right hand to Brenda and Granny Jones, and in the other hand, he held her chart. "Well, Brenda and Granny, what can I do for you today?" inquired the doctor. "Granny seems to be getting more forgetful, falling down more frequently, and having more bathroom accidents. I don't know if I can keep her at home any longer," began Brenda. "Well, when you get to be my age, you are allowed to forget some, and I can help it if the bathroom is too far away," interjected Granny Jones with a sudden burst of emotion. "But Granny, the bathroom is right next to your bed and you have a commode chair. It is also not normal to forget where you are and forget the names of your children," countered Brenda with tears in her eyes. "Brenda, so you think it may be time to look at nursing home placement for Granny?" "I'm afraid so. I can't think of any other options," responded Brenda, still with tears in her eyes, wiping them with a white tissue. "I'm at my wit's end. I'm not going to any nursing home. I'd rather go to prison or die. I wouldn't do that to a dog," interjected Granny Jones, who was starting to shake and tremble at the thought of being placed in a nursing home. "I know that putting a loved one in the nursing home is a difficult decision, but sometimes it just has to be done. I know that the Heavenly Rest nursing home is a fairly good one, and one of my colleagues, Dr. Ducky Smiles, makes rounds there once a month," replied the doctor. "He only rounds once a month at the nursing home? Why is that?" inquired Brenda. "Medicare only pays for one doctor visit a month," responded Dr. Bruce. "I'd rather go to prison where I can get 3 hots and cot," cried Granny Jones with tears streaming down her face. "I know that this is a tough decision. What I'll do is get started on the paperwork. I'll let you take Granny home to your house and let you get started on organizing Granny's finances, because that is one thing that the nursing home will evaluate before they can consider admitting her," continued Dr. Bruce. "Organize her finances?" inquired Brenda. "Yes, the nursing home costs about $10,000 a month, and Granny's finances have to be depleted before Medicare will pay for her to be in the nursing home. If she still has a house, it needs to be sold," answered Dr. Bruce. "Sell my house and deplete my savings? What will I be able to leave my children? I'd rather go to prison," chirped Granny Jones with a tone of defiance in her voice. "I know it is a lot to think about, but give me a call later this week and we can work out the details," concluded Dr. Bruce as he got up and left the exam room. The ride back to the house was quiet, with each of the women involved in their own thoughts. Brenda was feeling guilty because she realized that taking care of Granny had just gotten to be too much for her, but she did not like the idea of having total strangers take care of Granny either. In her mind would flash stories of nursing home aides being arrested for abusing elderly patients and stealing their valuables, and background checks revealing that they had previous criminal records. Granny Jones knew that her mind had been slipping, but was aware that she had spent a lifetime managing her finances, savings, and had paid for her house. She was not going to let some nursing home take what she had worked for all of her life. There had to be another option. Back at the house, the two women exchanged very few words because Brenda was feeling guilty, and Granny was still angry at Brenda for wanting to put her in the nursing home. That night, as Granny Jones lay in her bed thinking about all the years that she had saved money and managed her affairs, and now it had come down to some nursing home taking it all away. Suddenly, she bolted up in her bed, and in a fleeting moment of lucidity, she knew what she needed to do. She put her robe on over her nightgown and slipped into her house shoes. She went over to her chest of drawers and, reaching into the back of one of the drawers, removed a bundle wrapped in cloth. She opened the bundle, which revealed a stainless steel .38 caliber revolver with a 4-inch barrel. Pulling the revolver up from the cloth, she opened the cylinder and emptied out the bullets. She then snapped the cylinder back. She placed the revolver in one of the pockets of her bathrobe and then grabbed her stainless steel walker. Gliding the walker as quietly as she could across the carpet, she opened the front door and quietly slipped out the door. She rolled the walker along the sidewalk to the driveway and then down the sidewalk towards the All In and Out convenience store. It was about 10 o'clock. The clerk standing behind the counter of the All In and Out convenience store was a female who appeared to be in her early 20s with tousled, dirty blonde hair. She had barely taken any notice of the elderly woman with the stainless steel walker until the woman came up to the cash register and from the pocket of her bathrobe brandished a gun. "Give me all your money. This is a stick-up. Hurry up before I blow you another pie hole!" shrieked Granny Jones as she pointed the revolver at the clerk, who was at this point in a state of shock and stood there staring at what was taking place. "I said move it before I blow your brains out. Blondie, get a clue." This time she raised the barrel of the gun to the level of the clerk's head and pulled back the hammer to emphasize her point. The clerk opened the cash register and poured the contents into a small plastic grocery bag. She quickly handed it to the elderly woman, and at this point, what was happening had begun to sink in, and she started to shake and tremble. "Now, get down on the floor and cover your eyes. If you so much as move, I'll splatter your brains," continued the elderly woman as she turned her walker and started out the door. The clerk got down on the floor as she had been told, but hit the silent alarm button. By the time that Granny Jones had reached her driveway, she was surrounded by 3 police cars with blue lights flashing, sirens blazing, and guns pointed at her. Over the loudspeaker, a voice boomed out. "Lady, this is the police! Throw down your weapon and get on the ground now!" Granny Jones gently laid the revolver on the ground and did as she was told. 2 police officers rushed to her position and handcuffed her hands behind her back. The loudspeaker and the sirens had woken Brenda from a somewhat restless sleep. She grabbed her bathroom and, slipping on her slippers, ran to the front door. She then ran over to where the police cars were as they were taking Granny Jones away to one of the squad cars. "Officer, what's happening here?" inquired Brenda. "We just arrested this old lady for holding up the All In and Out convenience store, and we are taking her to the police station to be booked," replied one of the police officers. "You can't do that, she's 92, exclaimed Brenda with an expression of disbelief registering on her face. "We caught her in the act, and we have to arrest her," responded the officer, as if arresting 92-year-old ladies for armed robbery was part of the normal routine. Brenda then turned toward the police car, where they were loading Granny into the back. "Granny, are you okay?" "I'm fine, honey. Just be sure to visit me and bring several cartons of cigarettes with you," replied the elderly woman as she was being placed into the police car. "I'm getting my 3 hots and a cot along with free medical care." Moral: if it looks like the nursing home is looming in your future, maybe prison is a viable option because you can get 3 hots and a cot along with free medical care, and the only difference between the people in prison and the nursing home is that they haven't been paroled yet.